Okay, we are back and we are looking at the prescription process. Number 7. The prescription is prepared. So this is where the technician selects the correct product, measures the prescribed amount, places it into a suitable container, and attaches the label. And we talked about the law regarding the child-proofing of prescription medication. So child-proof containers are required by law unless the patient has filed a request for easy open caps. Okay, so here the prescription comes in, you select the appropriate medication. You also not only look at it, but also verify it by the NDC or National Drug Code, which is computer generated medication label. It's a medication that is being dispensed. You may have to do some counting of tablets and measuring of liquids, and that is preparing the medication depending on what the prescription is saying. Making sure that the medication is in an appropriate container, whether it is a bottle, a tube, etc. The label that we just finished talking about, so look over here, is placed on the appropriate container. And in most pharmacy is computer generated. And then once organized, the pharmacist will give a final check. So as you look at the process, there are many places where error can occur, but there are also many checks that also occurs. Then number 8, the pharmacist checks the prescription. The pharmacist performs the final check to make sure that the prescription is prepared as prescribed and performs the final evaluation and potential clinical issues. And so it is the pharmacist's responsibility to make sure that everything is fine. They should do an accuracy test and final safety check, and then they sign off on the prescription. The pharmacy technician then will place the prescription in the appropriate bags, for example, for the patient to purchase. And then there is a drug information sheet, which we talked about, that's placed in addition to the label that's placed on the container. And this regards to the different type of medication interactions and side effects that could possibly occur. All right. So the patient comes into the store, or a representative of the patient comes in the store, and it is the technician that completes his or final safety and accuracy check. This is done by ensuring that the correct patient gets the correct medication. This could be done, it could be given to the patient or the patient representative that signs the insurance log on other information. And if the patient has not yet signed the pharmacist's notice of HIPAA compliance, they are given a copy of the notice and asked to sign that log. The technician then rings the sale to the cash register. So there are a lot of things that a pharmacist technician does. So not only you have to check of the pharmacist that we mentioned before, we also have a check, the final check of the pharmacy technician as they interact with the patient or the patient's representative to pick up the prescription medication. And finally, this goes back to OPRA. This is the power that has been given to the pharmacist that the individual may ask about a particular drug, their counterindications, side effects, etc. That counseling can only be given by the pharmacist. So the technician calls the pharmacist to the counter to counsel the patients per OPRA in 1990 and other state professional statutes and pharmacy protocol. Okay, so that completes the prescription process. Again, each of the 10 steps can be prone to error, but each of the systems also has their own checks. All right, let's move and talk about pharmacy abbreviations. And in pharmacy, there is a lot of abbreviation. Of course, sometimes you have abbreviations that are the same, that looks the same for different things, but for the most part, abbreviation is very helpful in that it shorthands the writing process. You don't have to write out everything. And so there are abbreviations for the route of administration, there's abbreviation for the dosage form, there are abbreviations for the time of administration, and there are abbreviations for measurements. So these are some of the things that you should be familiar with. So let's go through some of them. And basically, in this particular time, you just have to memorize them. Okay, so for example, you have AD for right ear, ASAL for left ear, AU for each ear, OD right eye, OSOL left eye, OU each eye, PO very important. You see that all the time. It's by mouth. SL sublingually under the tongue. For example, nitroglycerin sometimes give under the tongue. Topical, top. TOP, topical or locally. PR, rectally. PB, passionately. INH, inhale, inhalation, inhale. P-neb by nebulizer. SC or SUBC, subcutaneous. SUBQ, also subcutaneous. IM, intramuscular. IV, intravenous. IVP, intravenous push. IVPB, intravenous piggyback. Please make sure that you are familiar with these key abbreviations. In your book, they give a little bit more. Different type of dosage form that you will see. TAB, tablet. CAP, CUP for capsule. SR, XR, XL, means slow or extended release. SOL, solution. SUSP, suspension. SYR, syrup. SIQ, liquid. SUPP, suppository. CRM, cream. UNG or OINT, ointment. Here are some of the abbreviations that deal with time. Again, very, very important. You need to know that by memory. BID, 2 times a day. TID, 3 times a day. QID, 4 times a day. AM, QAM, morning, each morning. PM, afternoon or evening. HS, at bedtime. PRN, as needed. AC, before meal. PC, after meals. STAT, immediately or now. Q underscore H, every whatever hour. So in Q underscore H, you put in 2. That means every 2 hours. If you put in a number here on the underscore, will indicate the amount of time that is supposed to give it every hour. Okay. Other measurements abbreviation that you may see. Small I, 1, 2, etc. SS, 1/2. GTT is drop. ML is milliliter. TSP is teaspoon, which is equal to 5 milliliters. We did some of that during our calculations. Tablespoon is 50 milliliters. Fluid ounce is equal to approximately 30 milliliters. And then you see an L, which means liter. G, or you may see a Greek symbol meaning micrograms. Okay, so that's micrograms. MG, milligrams. G, grams. MEQ, milliequivalent. AA, of each. AD, 2 up to. AQ, AD. Add water up to. QS, AD, make. As sufficient quality 2. Okay. And there are others abbreviations that you may see, less common, but still important. UTD means I as directed, and R, no refill. DAW, dispense as written. A C with a line on top of it, or W means with. S with backslash. O means without. Okay. One of the things that you should also know that you will see on some of the prescriptions that you probably have already worked on is signa. This is from the Latin word signa, meaning to write. It is abbreviated as sig or S, or left out entirely. It indicates the direction for use in administrative route. All right, let's look at some of the examples associated with a particular prescription that you may find. So if you're looking at this drug named Synthroid, it's 100 mcg tablets, IPOQAM. So what does that mean? Is take one tablet by mouth once daily in the morning. So the mcg here is micrograms. So these are 100 micrograms tablet of this particular drug called Synthroid. And then you have the I here. Let me get my cursor to point to it. Means one. PO, which is about by mouth. And QAM, it means in the morning. You have the next one here is called azithromycin. Again, the amount of medication per tablet is 250 milligrams. And you have different doses. This is the antibiotic, so it's being taken for up to 5 days. So you have two I's together means two, PO by mouth, today, of course, today. One I, the next day, you take one tablet by mouth, daily, the next 2 to 5 days. Okay, so day 5 is when you start taking this medication. This is an eye drop here. And what does this mean? That the medicine Ifalgan-P is 1% of the total amount that is to be given. So this is the medication is only 0.1% rather. And this is the eye drop. So once, this means drop, 8 hours. Okay, so every 8 hours. Right? And of course, OU means each eye. We talked about that before. Here you have Avid Discus, and this is an inhalant, INH, inhalant, 1 time a day by mouth. Okay, and this is given twice a day, BID. Enbrel, 50 milligrams. Okay, this is a subcutaneous injection once every week. Okay, Q, as you can see here, Q every 8 hours, Q in front of a week, once a week, and this is I, of course, is a subcutaneous injection. Okay, so these are some of the ways that you read a label, and this is some very good examples that you should be familiar about. In the labs that you have been given, we have done a lot of prescription work. Right? And so we are going to start this on our next segment, and we will speak again at that time.